After 20 years of practicing as a psychologist, I have never seen the need for mental health services in Australia. Mental health challenges for Australians have become the norm. The system is strained. The pandemic, the bushfires, the floods, and then the COVID recession have increased the pressure on the sector, which was already in need of reform. The emergence of COVID-19 reminded us to the importance of mental health and suicide prevention as a national priority. It's been described as the shadow pandemic, but no matter the name, we cannot ignore the crisis which lays before us. On the 10th of December 2020, the House of Representatives resolved to establish a select committee on mental health and suicide prevention. The terms of reference highlighted significant reports recently completed and work underway. The committee was tasked with inquiring into the current mental health system and its capacity to respond to events such as the pandemic and bushfires, as well as a range of matters beyond the scope of earlier reviews and reports. There have been significant efforts made by governments and non-government bodies to respond to the increased demand for mental health and suicide prevention services over the last 12 months and more. There have also been increasing calls by industry, consumers and carers for national reform to the sector. Mr Deputy Speaker, on behalf of the committee, I would like to thank the Productivity Commission, the Department of Health and the National Mental Health Commission for their evidence at the opening public hearing. This provided insight into government-led initiatives and reporting gaps, informing the work of the committee moving forward. Through this initial phase of the inquiry, the committee have noted several themes. Workforce, including workforce capacity concerns, the role of professional bodies and the need for multidisciplinary teams. The coordination of funding of services and outcome measurement. Accessibility and affordability concerns, especially for at-risk groups. Early intervention, including stepped care, telehealth and digital health services, and stigma as a barrier to accessing services. Mr Deputy Speaker, we also thank the individuals and organisations who have contributed submissions to this inquiry. The committee will now move into phase 2 of this inquiry, and let me assure stakeholders that the committee has heard their concerns and acknowledged the sector's desire for government to implement change. Reports, reviews and strategies are essential tools, but we must bring the community with us to drive change and improve people's lives. The committee, having considered these government reports and strategic reviews, will now look to identify those areas that need further attention. We will engage with stakeholders across the country through a series of public hearings to listen to views from those who are on the front line, providing services, innovating to meet challenges, lobbying for change and training the workforce not only of today but of tomorrow. I would like to thank the Secretariat for the long hours and hard work they have put into the committee to date, and also members of the committee themselves. The final report is due in November this year. On behalf of the committee, Mr Deputy Speaker, I would like to commend the interim report to the House.